Hi, I hope you'll find the emails helpful. I thought I'd do a quick video in explaining how the process of seeing a speech therapist works. So initially you should see a speech therapist to begin with when you're in the acute hospital after you just had your stroke. Once you're medically fit, you'll be referred to speech and language therapy, and we will come and see you and help you understand what communication difficulties you're having and how we can help you. So this will be done by someone coming to talk to you, get some information about you and your family and interests and any other information which will be relevant. And then we will do a formal assessment, which will involve you doing some rather interesting activities, and this will help us understand what difficulties you're having and what strengths you have. And we'll also ask you. You can tell us what difficulties you're having, and so can your loved ones, and that's really informative. So once you've been seen by a speech therapist in the acute hospital, you tend to leave the hospital as soon as you're medically fit, because obviously doing rehab in other contexts is much, much better. So you'll either go to an inpatient rehab unit, depending on your severity. Usually you go to inpatient bedded unit if you're quite severe. So that also involves you having impairments in other areas such as your walking and your thinking skills. If you're safe to go home, then it's best to go home because rehab in your home tends to have the best outcomes. So in that respect, you will be seen by someone like me. We will come to your home or you'll come to a clinic and we will do speech and language therapy with you, and we will start your rehab process. How often you see someone like me really varies upon where you live. Sometimes you can see someone every day, sometimes you see someone once a week. Unfortunately, it does vary upon where you live and what services are available to you. You can also access private speech and language therapy. Obviously that is at a cost, but irrelevant of which process you go down, whether it's NHS, private or both, fundamentally it's important to remember that that therapy, although it's precious time, is what you do around that therapy session that is the most important. So practice your exercises, use those strategies given to you, because that's what will help improve. How long will you see a speech and language therapy for? That is the $1,000,000 question. It varies on numerous reasons. Sometimes, again, how much capacity your service has, and how long they can offer a service to you, and also how long you need some speech and language therapy. Sometimes you'll only need a month's worth. Sometimes you could need years. Also, speech therapy comes in many different forms. That can be through face-to-face, it can be going to communication groups, so there are many different ways of being able to access therapy. So hopefully that's what helps you understand the process of speech and language therapy and when you'll see someone. You may see a speech therapist the entire time and the same person. You might see different speech therapists and then finish off your therapy in a communication group. It really varies upon where you live, and all different types of therapy will help you get better. So, as a speech and language therapists, we have a wonderful job in helping you get better and to improve your communication in whatever form that may be, and giving you a better quality of life after your stroke. However, I think the downside of our job also is having to help you understand and accept that sometimes things don't go back to how they used to be. And that's really difficult for everyone. But as speech and language therapists, we're here to support you with that process, and also offer you advice in where else you can access advice and support, and also how best to adapt to your situation. I hope this has helped. Thank you.